And I'll give you my 2 cents on health care, and then we'll see how it goes. As with a lot of things, it's about money. Now, I might have talked about this before, but people who don't have health care, basically, or prior to the Affordable Care Act, or Obamacare, however you want to characterize it, couldn't afford it for 2 reasons. They're either too poor, or they had pre-existing conditions which made the cost of their care too expensive for an insurance company. So the Affordable Care Act basically provided subsidies for people who couldn't afford it and brought everybody in for the pre-existing condition, and then basically said, anybody who doesn't have health care, you have to buy it or you're going to get a penalty, which in many respects for a lot of young people was a tax too. So there's 2 ways to pay for these subsidies. You either raise taxes or premiums are going to go up to account for the cost shift. I mean, it's the way it is. It's just pretty simple math. Now, in Washington, I can appreciate an argument that, you know, we can't afford this. Medicare, Social Security, a lot of entitlement program pressures. We can't afford another entitlement program. And I think there are people who say that, who believe that. But it's hard to say, oh, we're going to take away those subsidies and everything's going to be better. Like I said, I can appreciate the argument, we can't afford it. I don't know if it doesn't matter whether I agree or disagree. I understand that. But I can't understand to take away the argument to say, well, we're going to take away the subsidies and we're going to make it better.